Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. In this presentation, we are going to look at 2D echocardiographic features of pericardial versus pleural effusions. It is not uncommon to see pericardial effusion, and sometimes we can see pleural effusions or a combination of both. When we are presented with a situation where there is some echogenic space behind the left ventricle on a parasternal long axis, or in other views, how do we differentiate between pericardial effusion versus pleural effusions? So let's dive right into the main presentation. And here is a picture which is sort of like a left side, right side inverted. Anyway, here's the left ventricle, here's the mitral valve, here's the left atrium, here's the ascending aorta, aortic valve, right ventricle. And we are more interested in looking at the posterior wall of the left ventricle. And here is the descending thoracic aorta. This is one of the important marks. This is a descending thoracic aorta, which is most important landmark. Anything that is in front of the descending thoracic aorta, an echogenic space represented by effusion, whereas the descending thoracic aorta, any space behind is transparent, is showing pleural effusion. In other words, a pericardial effusion does not extend beyond the descending thoracic aorta, whereas left pleural effusion extends behind the aortic ring we see here. Here is the coronary sinus, left atrium. So this is a very important distinction I want you to keep in mind. Let's move on and let's look at another picture here. And as we can see, this is like a apical four-chamber view. Here we have the left heart, right heart chambers, and here we have a fluid which stops short in front of the descending thoracic aorta. So this is a large pericardial effusion which goes around, and you can also see the same pericardial effusion on the right side of the heart, encircling the right ventricle and the right atrium. And sometimes we see the pleural effusion also behind the right atrium, and we'll come to some of those images in a second, but they are not going to be associated with large pericardial effusion. See here, and there are other ways to differentiate the right pleural effusion. Now let's look at this example here. This is the short axis of the left ventricle, and here are the papillary muscles, and here is what looks like a collapsed lung, atelectic lung. Here we have the aorta, and here's a large echogenic space. This reflection of left pleural effusion. Not pericardial effusion because it is not next to the heart epicardium here, and we have a echodense tissue here which is part of the atelectic lung. So this is a pleural effusion. This is in the short axis. Let's move on to the next image here, and here we have like an apical four-chamber view. As you can see, the effusion stops right here before the left atrium ends, and here is a small pericardial effusion, and behind that, and here we have the aorta, and here we have an echogenic space sort of goes behind the aortic shadow, and this reflection of pleural effusion. So sometimes we can see both pericardial and pleural effusions. The way to differentiate is, where does this fluid stop? If it stops right in front of the ascending aorta, which is here, that means that it's effusion. Beyond that is pleural effusion. Here's an example of an apical four-chamber view. You can see the clear-cut image of a collapsed lung with very large pleural effusion. I don't know, it could be even pneumothorax, but there's some shadows here. So this is an example of a pleural effusion, very large pleural effusion. Here we have the left ventricle, right ventricle. We don't see it any much on the right side. If there was right side effusion, also because left also. And here's an example of a four-chamber view of the heart: left ventricle, left atrium, right ventricle, and we don't see a big, large pericardial effusion around the left side of the heart. But here we have a large pleural effusion, which is compressing the right atrium, and it is going beyond on top of the right atrium. It's important to realize that pleural effusion can compress the right atrium just like pericardial effusion, but generally, if you see a compression of the right atrium with no evidence of fluid in the pericardial space in other regions of the heart, you're not dealing with a cardiac large effusion or a tamponade. So this is an example of a pleural effusion causing collapse of the right atrium during cardiac diastole. And then here is a CT scan of the same patient showing moderate pleural effusion on the right side. And here's an example of the same large pleural effusion. And once the pleural fluid was tapped, you can see there is expansion of the lung tissue and the right atrial collapse sort of appeared. So this is an important feature to keep in mind when we are trying to differentiate between pericardial effusion and pleural effusion based upon 2D echocardiography. And here's an example of like a short axis view of the at the level of the inferior vena cava. And here we have the vertebral body. This is the left side, this is the right side, and the left pleural effusion is to the left of the vertebral body. The right pleural effusion is to the right side of the vertebral body, as the pleural spaces do not cross the vertebral body, so they are sort of loculated within their own space, the left pleural space and the right pleural space. So this is, we don't see this image in cardiac studies, but like a focus ultrasound where they're looking for the inferior vena cava size and the presence of pleural effusions. This is a good image to look at the cross-section at the IVC at the hepatic vein level. So ladies and gentlemen, here's another example of a echogenic space going around the right ventricle apex and the left ventricle. And as you can see, it's probably the descending thoracic aorta. So we are talking about a pericardial effusion. And beyond that, there is some echogenic space, but it is not clear as expected to be. There are some fibrin strands noted here because it's not as echogenic as anterior region. So this is how we differentiate between the pericardial effusion and pleural effusion based upon position to the descending thoracic aorta and the vertebral bodies. As I said in the previous here, vertebral bodies help to identify demarcation of the left and right pleural spaces. So ladies and gentlemen, this is a quick overview of how to differentiate between pleural effusion and pericardial effusion, both right and left pleural effusions from pericardial effusion. Hope this has been useful to you. Thank you so much. We have hundreds of tips on echocardiography. You can watch them. I will see you in the next presentation. Thank you so much.